Skipper?
Not so good.
This is no problem.
Dr. Gallo, your next patient is here, Shira. She's a screamer.
No problem. Hello, Shira. How are you?
Dr. Galler, your second cousin, once removed from Florida, just called. He needs a root canal on number 32, but he's not paying for it.
No problem.
Dr. Galler, Lisa's here for Invisalign. She needs IPR on all her front teeth.
Big problem.
Willie, where you going?
No, I can't do it. I don't care. Anybody else? I can't do it.
What am I going to do?
I can't help you.
If a patient presents with mandibular or maxillary crowding or insufficient room in the arch, there are 4 common known ways to solve the crowding. It is up to the practitioner to decide which solution works best for their respective patient. That decision may be influenced by the patient preferences, particular malocclusion, and/or the orthodontic system being utilized by the practitioner. The 4 most common methods are 1. Expansion, 2. Interproximal reduction or IPR, 3. Extraction, and 4. Distalization. We will now review these 4 methods in use with clear aligner therapy. Expansion is defined as an orthodontic method used for correcting narrow or collapsed maxillary and mandibular arches. The widening of the arch creates more room for all the teeth to move into. The power of expansion makes it very attractive as a solution to crowding when dealing with very narrow arches or an arch with a sigmoid bend in it. Expansion can best be understood by examining the following analogy. If you have a circle where the diameter is 1 millimeter, then because the circumference of the circle is known to be c equals pi times d, the circumference of the circle is 3.14. If one extends the diameter of the circle from 1 millimeter to 2 millimeter, the circumference does not increase by 1, it instead increases by a factor of 3.14. Said differently, for each 1 millimeter expansion of the diameter of the circle, the resulting circumference increases by 3.14 millimeters. In the adult arch, a similar relationship can be created for each 1 millimeter of expansion of the arch. The circumference increases significantly, which allows more teeth to fit in. Thus, in order to solve crowding in this narrow arch, increasing the circumference of the arch by expansion is sufficient to create the room necessary to correct the crowding. The second method to solve crowding in the adult orthodontic arch is extraction. In this method, a single tooth or 2 is extracted or removed from arch in order to alleviate the crowding situation. The space provided by the missing tooth can be utilized by the remaining teeth in an organized straight alignment. While the extraction of first bicuspids with traditional braces is common, in clear aligner therapy this modality is most often employed on single anterior teeth when they are clearly displaced to the buccal or lingual of the arch. The third method for correcting crowding in the adult orthodontic arch is second molar distalization. In this method, the teeth in the upper or lower arch are all displaced backwards towards the posterior of the mouth in order to create more room in the anterior. This methodology is reserved mostly for class 2 malocclusions, distalization of maxillary arch, and Class 3 malocclusions, distalization of the mandibular arch. Distalization without headgear or TADs, temporary anchorage devices, can prove difficult. It is not highly recommended for use with clear aligner therapy only. The fourth method to correct crowding in the adult orthodontic arch is interproximal reduction, or stripping of the teeth. In this method, a small amount of enamel between two adjacent teeth is removed to allow the teeth to move into their desired location. This method is very desirable in clear aligner therapy where distalization can be a challenge. The amount of enamel removed is a small fraction of overall tooth structure, and studies have proven that the resulting teeth actually have a lower incidence of caries and periodontal disease in the future. IPR and its predecessor ARS, air rotostripping, have been accomplished for many years using three basic modalities: high-speed handpiece and burrs, low-speed straight nose cone handpiece with discs, finishing strips. Each of these presents certain challenges to the practitioner when performing interproximal reduction. When a dentist graduates from using these archaic instruments to more modern instrumentation, they will find the IPR process simpler and error-free. We will now describe the use of each of these instruments and the inherent problems in each. The oldest method of creating space in between teeth is to use a high-speed handpiece with a thin burr. This creates several problems. Patients do not appreciate the high-speed noise. The procedure can often be painful and cause sensitivity. The burr cuts the embrasure of the teeth in its attempt to cut the contact. This leads to spaces that are too wide, teeth that have irregular anatomy, teeth that appear flat. As you slide in between the teeth, you wind up removing the enamel in front of and behind the contact. This area represents the embrasure of the tooth. Once removed, it cannot be replaced, and the tooth morphology and appearance will forever be damaged. It is also difficult to make very small spaces with the burr, since the minimum thickness of the shank of the burr passing between the teeth often yields a minimum space of 0.4 millimeters. The second common method of performing IPR is to use a diamond disc that rotates in a straight nose handpiece and slices the contact in between the teeth. This methodology presents several challenges. Awkward handling and very difficult maneuverability, as the straight nose cone instrument was never intended to be used in the mouth and is often thought of as a lab instrument. It is very easy to damage the surrounding soft tissue of lips, cheeks, and gingiva. Creates contacts and proximal surfaces that are very flat and uncosmetic. It can unfortunately slice into the tooth, creating a ledge. This X-ray represents the potential risk to the teeth if using a slow-speed handpiece and disc. Even when great care is taken, this can often be the result for even the best dentist because of tooth inclination and positioning. The third most common method for performing IPR is using finishing strips to slowly abrade the enamel off of the proximal surface of the tooth. The inherent problems with this method are painstakingly slow, awkward handling, discomfort for the patient, half hanging down throat, half over front lip, inability to create more than 0.1 millimeter. Once the contact is opened, it is very hard for these instruments to create more than a very minimal amount. Summation using the current armamentarium usually causes patient discomfort, very technique sensitive, can adversely affect the case outcome, can cause ledging of the teeth, can destroy embouchures, and subsequently tooth morphology and anatomy. It's generally considered very invasive and is a source of high anxiety for dentists and patients alike. The goals of a successful interproximal reduction instrument and method are the following: have no capability to ledge the tooth being stripped, pose no danger to soft tissues, allow us the ability to perform IPR anytime on any teeth regardless of access, allow for only minimal reduction of tooth structure without removing the embouchures of teeth. The Gahler spacing technique, or GST, allows accomplishing all of the goals of IPR in a safe, predictable, and easy manner. The Gahler spacing technique consists of two phases. Phase 1. Use instruments to break the contact between the teeth in minimal, non-invasive fashion. The instruments used to accomplish this are the single-sided quick strips from Axis Dental or single-sided space files from Raintree Dental. In this video, we will demonstrate the use of single-sided quick strips for Phase 1. Phase 2. Create the desired space for the IPR from 0.1 mm to 0.5 mm. The instrument used to accomplish this is the double-sided space files from Raintree Dental. The quick strips come in 5 different colors: white, yellow, red, blue, and green. For the purpose of GST, only the single-sided version is used to break the contact. The white one is also not used for IPR and is primarily used to remove excess cement during restorative dentistry. Quick strips easily pass through the contact and can open space quickly with ease. However, they only create minimal spaces, not large ones, and are thus ideally suited for Phase 1 breaking the contact. They also wear out quite quickly and should be replaced very often. Additionally, for breaking the contact, one may use single-sided space files. The main instrument used in the Gawler spacing technique is the double-sided space files. These instruments may be inserted into a reciprocating handpiece sold by Raintree Dental. In the Gawler spacing technique, one does not use the rotary air-driven handpiece for space file. One simply grips in their fingers. There are 2 ways to grip the space files in the Gawler spacing technique, with slide rubber grip and finger grip. The Gawler spacing technique advocates use of these instruments by holding them manually. These instruments come in increasing size and grit. Each color represents a different size and grit that can open an increasingly larger space. They are used sequentially until the practitioner achieves the desired space opening. Tactile control allows the practitioner to feel when the desired space has been achieved. This will make conventional measuring with a gauge obsolete. In this chart, one sees the sizes that are made by each colored double-sided space files when used by hand as it passes in between the teeth. This chart should be copied or written down, as these size measurements are not available from the company and are the key feature of GST. We usually place some topical anesthetic on the gingival to prevent irritation or bleeding, and to add another layer of comfort to the patient. GST recommends the use of IPR gel manufactured by New Utrecht Pharmacy. In GST, the first goal is to break the contact between the teeth. To accomplish this goal, one may use the single-sided space file or the single-sided quick strip. We will now demonstrate the use of quick strips. Phase 1 of GST breaking the contact. In GST, you are supposed to grip the quick strip in the thumb-forefinger position. Grip the yellow single-sided quick strip to start and slide into the contact with a sawing-like motion. It should pass easily with minimal resistance. Once the yellow quick strip passes freely, you are done. Then grip the red single-sided quick strip and slide into the contact with a sawing-like motion till it passes freely. Then grip the blue single-sided quick strip and slide into the contact with a sawing-like motion till it passes freely. There is no need to continue moving in and out to create more space. We will move to the next size. Then grip the green single-sided quick strip and slide into the contact with a sawing-like motion till it passes freely. This will have created just under 0.1 mm of space and will have been fast and easy. Phase 2 of GST, making the required space. Reminder, there are several ways to grip the space files. We will demonstrate using space files randomly showing different grips. A. The finger grip, with thumb and forefinger on shank. B. Rubber grip using the space file grip. Gripping the gray double-sided space file, slowly slide into the contact and pass in and out till the space file passes freely. Once it passes freely, move to the next size. Gripping the purple double-sided space file, slowly slide into the contact and pass in and out till the space file passes freely. Once it passes freely, move to the next size. Gripping the white double-sided space file, Slowly slide into the contact and pass in and out till the space file passes freely. The space is now always a perfect 0.1 millimeter space. Gripping the yellow double-sided space file, slowly slide into the contact and pass in and out till the space file passes freely. The space is now always a perfect 0.15 millimeter space. Gripping the red double-sided space file, slowly slide into the contact and pass in and out till the space file passes freely. The space is now 0.2 millimeter space. Gripping the blue double-sided space file, slowly slide into the contact and pass in and out till the space file passes freely. The space is now 0.3 millimeter space. Gripping the green double-sided space file, slowly slide into the contact and pass in and out till the space file passes freely. The space is now 0.4 millimeter space. Gripping the black double-sided space file, slowly slide into the contact and pass in and out till the space file passes freely. The space is now 0.45 millimeter space. The Gauler measurements of space files are the key feature of GST and should prove to be very exact. Make sure to copy down these measurements and reference them often until they are memorized. This should make the use of any gauge to measure space extraneous. The practitioner must always begin with phase 1, breaking the contact using the single-sided space file or single-sided quick strips in correct color order. Then the practitioner should use phase 2, starting with gray double-sided and moving through the other grips until the desired space is achieved. Do not skip colors or steps. Avoid using worn-out instruments. Make sure that the grit is still strong and not worn out. Use the grip that is most comfortable for you. Some practitioners might like finger grip with certain sizes and rubber grip with other sizes. Here are several before and after photos demonstrating how IPR can easily be achieved between teeth where access is not easy. These will be easily replicated by even the most novice IPR practitioner when using GST. This demonstrates how perfectly space can be created using GST even where access is not easy. Here, 0.4 millimeter of IPR was created between teeth number 25 and 26. See how there is no ledging and no changing of contour? This can be easily replicated by any dentist using GST.